Great. Hi, welcome everybody to our February meeting. Um, Katie's going to walk us through tech check here, and then we'll get going with the agenda.
Perfect. Thank you so much. As a reminder to all, we do have interpreters on the line for anyone who would like to hear Spanish interpretation. So first things first, at the bottom of your screen, you will see a little globe that says interpretation. Please click that and select the English language. If you are calling in from your phone, unfortunately, you do not have this option, which means that if our Spanish-speaking committee member does speak, you will not be able to hear the interpretation, unfortunately. That is a Zoom restriction we haven't gotten past yet. But other than that, please just remember, if you are a committee member, to keep your camera on if you are able. If you can't, that's okay. And raise your hand if you would like to share comments or feedback, and co-chairs or staff will call upon you. Other than that, we will go ahead and get right into roll call. So starting with Michelle Glass.
Present.
Amy Fellows.
Here.
Grace Hokog.
Present.
Mickey Durding. Juan Pablo. Colin Stackhouse.
Present.
Max Brown. He doesn't have capability to join audio yet, but there we go. I'm going to circle back to Max because I know he's here. Jensina Hawkins.
Present.
Jay Brown. Craig Newton.
Here.
Yesenia Hernandez.
Present.
Jocelyn Ogden. And then Max Brown.
Present.
Wonderful. Thank you so much. I will turn it back to the co-chairs.
Great. So our agenda for the day is we're going to, Michelle's going to lead us through some updates and our work plan, checking in where we are on that, and our engagement timeline. We have a visual to share, and public comment, instruction, draft reviews, and website input from our last meeting. There have been some updates and work done on that we want to share with you all, as well as the public comment tips draft. Then any updates from any of you on activities or opportunities for engagement. And then we will have, oh, I'm sorry, somewhere in the middle of there, we also have a guest today, Patty Wentz, who's a communication specialist that's going to talk to us and get us starting thinking about healthcare communications and strategic communication. And then at the end, we have meeting reflections, future topics, public comment, and then we adjourn. So Michelle, you are up.
Thanks, Amy. Good afternoon, everyone. Good to see you all. Just a quick touch base on where we're at in our work plan, because I know this is a really action-focused group. So I want to make sure that we're all tracking where we're at and answer any questions you all have. So next slide, please, Katie. So we have two work streams, if you'll remember. One is community engagement. So this is our community engagement work stream here at the top. We have completed a review of existing scans and community engagement to understand and honor existing feedback. And we have shared the summary of that scan after discussion with all of you, with the other committees, to help inform plan design and financing for the Universal Health Plan. So that's done. We have an ongoing process where we're identifying strategies to engage with stakeholders across the state. And that is something that you all have helped us to identify existing groups and meetings that we can leverage to reach folks where people are already gathering and organized. We have some other items on this work plan for community engagement that will be coming in the future. So engaging with key partners, what the legislature asked us to engage with as a board is to, once the plan design and financing plan drafts are ready, to take those to these key stakeholders and ask for feedback. So it's not like a general, like, what are your thoughts on universal healthcare, right? It's like, here's what the board has come up with. What are your thoughts? What do you think works well within this? What do you not like? What do you see as missing? And have that kind of feedback that can then directly go into revising those drafts. So we have heard an update from the other work groups that are working on plan design and also coming up with a financing strategy for universal healthcare in Oregon, that they think that they should have a draft ready for us to do this engagement around June. So if that timeline does not change, that is our current plan. So that means that Diana, that you all have met from Artemis Consulting, that will be helping to do this outreach, this engagement, has paused her contract with us, will come back to us in around April-ish to start working with all of you on designing the questions that we will then use to take those drafts out for engagement. Then we have this item that is developing a plan for general public outreach to engage throughout the finance and operations committees, again, going beyond those targeted groups to see who and how we can engage with the general public. The tricky thing here, just to be totally transparent, is that we weren't really funded to do this comprehensively. So we'll have to get creative as a committee and figure out how much of this and what tools we can leverage to make that happen to some degree. And then present feedback. So one of our responsibilities is, as we hear feedback, bringing it to the other committees and to the full board to really inform this plan as it's being developed. And that'll be an ongoing iterative process, like back and forth, right? As we do engagement, bring it back to the board, do more engagement, bring it back to the board and the committees. But again, the last part of this community engagement work stream is all dependent on having those draft plans in hand, and we will have those this summer. So wanted to just orient us all to that work stream, which is on pause until about April, which is when we'll all circle back with Patty, or not with Patty, with Diana, to start drafting those questions. So what that's allowed us to do is to pivot, which is really strategic actually, and sets us up for success with our community engagement. Pivot to our communications focus, which we'll start doing today. Other community engagement deliverables are use existing mechanisms to get feedback and identify gaps. So that's the deliverable related to this task up here of doing the scan. So you'll see these are all aligned. Community engagement outreach plans, that's what Diana is going to be drafting and bringing to all of you for feedback when she comes back in April, along with questions to ask in those focus groups. And then those presentations to bring feedback to the other groups. So we've got tasks and then deliverables that support those tasks for our community engagement work stream. Can we check the next slide and see if there's any more for community engagement? No. Okay, can we go back for a second? So again, this allows us to pivot to do some strategic communications, conversations and trainings, which we've invited guests like Patty Wentz, and we're so excited to hear from today, that can help us to think about how do we take these draft plans to the community, to these targeted groups, and ask for feedback in a way that does no harm. We know that we can ask the same question 6 different ways and probably elicit 6 different types of answers. So we do not want to play into existing harmful stereotypes that are out there, or misinformation or misunderstandings of what universal health care is. We want to be very clear so that we can solicit feedback that is actionable and helpful and empowering. So that is why we are shifting to communications as a focus, so that we will all have these strategic framing, this knowledge base that we can leverage to, sorry, my golden retriever wants to join this conversation. Hopefully you can't hear her, that we can leverage to then be good thought partners with Diana in designing those questions in the most strategic way. They'll have the best outcome. So before I jump to cover the communications work stream and where we're at there, does anyone have any questions? Does this make sense to folks? This timeline? I know it's right after lunch. if you have questions, please just raise your hand, and we'll jump to you. So let's go to the next slide then. So communication. So you are here, right? If this were a map, instead of a spreadsheet, this would have a big star and it would say you are here. So right now we are in the process of identifying communication materials needed to develop strategies to do effective public outreach. And you all started this back in November, so thank you so much. Y'all have like really been ahead of the kind of leading one of the leading committees for the board, identifying a bunch of things that were needed, and we'll be touching base on some of those today, thanks to the hard work of staff, like the process to help people give public feedback and understand what that process is and how to engage with it. So that is ongoing right now. And where we're starting today is the second one under communications tasks, the identify the best messages to communicate the value of a universal health plan. So that's what Patty is going to start us thinking about, bringing her expertise and so that we can all learn and become good strategic messengers to go back and do that community engagement in the most thoughtful way. So just like with our work plan on the previous slide, we have tasks and then deliverables. The deliverables are just like, how do we know we've accomplished this task? So they're very similar. So developing a communications plan, a message strategy that includes materials. We will be contracting with a consultant to help us to do that. But we want you all to help to review those materials and inform them, which is why we're bringing presenters to help us all think about how to do that the best way. And then a minimum of 10 presentations of the draft plan for plan design and how to finance it. So that's those presentations Diana will be doing, as well as any other presentations we're able to do to those targeted groups once we have those draft plans. Does this prompt any questions? Do folks have a sense of like where we're at in our work plan, what our role in it is, yes, Colin.
Just one of the last statements you said about the 10 presentations Diane is doing. She's organizing those, right? It's not just her presenting, or is that like she's the facilitator, but people from the communications and plan design or whatever committees will probably be participating. I think we've touched on that before. Do you understand my question?
Yes, she will be facilitating. I think that it'll be a strategic decision for each group would be my sense. So if there are groups that are like very skeptical and maybe they know and trust Diana, because Diana is well known in the kind of healthcare policy world. And Michelle Glass, who has also been like a community advocate for health equity issues, being in the room is not as helpful in fostering trust and getting the most open feedback, then I'm going to say, you know what, you got this. I'll read the report, right? But there may be other groups that are where we would be, it would be great to have as many folks in the room as possible to maybe like create extra context or whatever. So I think it's a strategic decision, maybe depending on who we're engaging. But that decision is part of, I think, that plan that Diana will be coming back and drafting with all of us. Go ahead, Amy, or co-chairs.
Yeah, I was just going to add that another example of that is when we meet with provider groups, we have several providers on the board. So it would be the providers that would likely be, involved in those conversations, not Michelle and I, who are not providers, if that makes sense. So each thing will be carefully thought about who the right folks to bring are.
Yeah, but that's not to say that I do trust and believe and plan for like the way I'm thinking about this is that there will be opportunities for all of us to be in some of those meetings, especially when the board meetings travel around the state and we do some engagement with the community that we're in that, that city or whatever, and we do some engagement at the same time. I think those will be great opportunities. And then all of us in our personal capacities are also, doing engagement outside of those 10 presentations. So yes, and just like everything, everything is a strategic decision that needs to make sense in the context, I guess. And that's what all of us will be figuring out and deciding and planning together. So thank you for raising that question early. Any other questions or comments on our work plan? All right. Well, nothing like a dry work plan to start a committee meeting. Thank you all. I'll pass it back over to my co-chair fellows.
All right, so I think that next, Katie, were you going to walk us through some of the follow-up from our last meeting that staff has been working on?
Yes, I will definitely be talking about the public comments.
Oh, I'm
However,
sorry. Did I skip over? I'm sorry. Well, the next item again, co-chair class, is the engagement timeline visual.
All right. Well, then you're stuck with me some more. At the last meeting, so we really try to be responsive to you all and really appreciate how engaged this group is. One of the suggestions that was excellent that was made at our last meeting was that we create a visual for the timeline of this work plan that we just went over. A lot of us are visual learners, and so thank you, staff, for making this happen. This is the Universal Health Plan Governance Board work plan visualized on a timeline. So you can see here on the left side, starts with January. We have the 3 years of our work. So last year, this year, 2025, and then at the bottom is 2026. And you can see that we started last spring with building the Universal Health Plan Governance Board Foundation, basically forming the board, hiring staff, those sorts of things. And then we spent from May until the end of 2024 really developing putting together the committees. Like all of you applied and joined and did orientation, and we started our committee work. We provided our first status report to the legislature at the end of last year, which is on OLIS if anyone wants to read it. And if you can't find it, let us know. We're happy to get it for you. And then we're in phase 2 right now, which, as I just touched on, is proposal development. So the other committees are parallel working to us on one committee is working on the plan design, one committee is working on the finance plan. We are preparing with this strategic communications, kind of gearing up and getting all the information and best guidance that we can to then plan the community engagement for those draft plans. And then the reason the whole year is proposal development is because once we have the draft plans, we'll be taking them for community engagement. And then that community engagement will come back and inform changes to those plans. So we will basically draft some stuff based on the scan that we already did to honor that existing feedback, take it out for additional feedback, make some tweaks, and co-develop something with that input from our community engagement. And then next year is phase 3, which is trying to finalize things into a report and recommendations to go back to the state legislature by September to say, here's how we think this would work. Here's what you asked us to do. You asked us to design a plan to get some feedback from key stakeholders on it, to figure out a draft plan for how it would be financed. And here it is with our recommendations for implementation. And then the ball will be in the legislature's court at that point. So that's big picture, kind of what this work looks like. And we are right in the middle of it. So is that sorry. Okay, perfect. Yes. So now we can zoom in a little bit and you can see who's doing what basically according to this visual. And you all have this in your email as well. So print it, put it up on your wall. It's of course fascinating and really helpful to see it all visually. So we actually started, you can see us down here at the bottom. So there's the blue block at the top, which is the governance board, the orange block in the middle, which is all of the actual work that's happening in committees like here. And then the yellow block at the bottom is the final report to the legislature with those recommendations. So you can see at the bottom of the orange block, work stream 6, community engagement, we were one of the first work groups to get started. And that is because this board recognizes how much planning it takes to do really good, thoughtful, strategic engagement, and how critical community engagement is for the success of this plan. So we were one of the first work groups to get up and going. Financing also got up and going a little bit early, but plan design and expenditure got started a little bit later, and that's why they won't have a plan ready for us until this summer. And then our communications work stream phased in a little bit after our community engagement work stream, which is where we're at now, is starting this communications work stream. And we go all the way through, we started the first and we go the longest of all of the committees as it was planned, as you can see. Do folks have any questions about this visualization? There's also an operations work group that will be started and a transition plan work group that will get started once there's more of a plan and a little bit of feedback coming in on the plan to figure out how we go from our current system to this new system that we're going to need. So that's the big picture and how we fit into it. Questions? Comments? There's one more slide, which is really just zooming in on our role. And this is basically a summary of what we covered when we looked at the work plan. It shows all of our tasks and deliverables, what we've completed, what we're doing right now, what the timing in which we think that we will pick up these other tasks and deliverables that are in our work plan. And it's just on a timeline instead of in a spreadsheet. So thank you, staff, for responding to this request and this suggestion. I think it's really helpful. Do folks find the visual more helpful than the work plan when we touch base for future meetings? Yeah, okay, great. So for future meetings, we will probably just pull up the visualization when we touch base on where we're at. And if folks have any other questions, you can reach us via email and we welcome that. So now I will turn it over to Katie.
Thank you, Co-Chair Glass. So from last month's meeting, the committee gave a ton of great feedback on how we can better, how we can make public comment much more accessible to anyone that would like to provide it. So if you just want to refer to your materials 4.1 Common Instructions Draft, which I'm sure you may have been able to review, but Jenny was able to incorporate the feedback that was provided. Just a couple of things to note. Right now, our website, the board's website, is going through a domain change. And so we're not able to make any changes right now to the public comment form. However, Jenny has taken those and we are ready to work with the DCBS communications team as soon as the website's ready to be adjusted, and we'll be able to incorporate all of that feedback. So you'll be able to see just this slide just kind of captures some of the feedback that was provided and what Jenny was able to incorporate. Does anyone have any questions about that document? Great. We're going to go ahead and move on to the public comment tips draft. So Jenny created this based on feedback from the committee, and this is going to go, it will be posted on our website as a tips for users, and it's also going to be incorporated in our Zoom registration email. So we had wonderful feedback provided last month to have the Zoom registration for any committee or board meeting, have that include either a link to the public comments or something that will help make it easier for people to submit public comments. So a link to this tips draft or this tips document will be included in that registration email, as well as posted to the website under the public comment section. If you have any feedback about this draft document, please reach out to Jenny and send those her way, and she will incorporate before the next meeting. Any questions about this document? So definitely, I just want to reiterate how appreciative staff was with all the wonderful feedback last month. I think that it was very, very helpful, and it's going to make our website more accessible and seamless for people. So thank you. It's really great feedback. It's appreciated. But with that, we are running a little bit ahead of schedule. Co-chairs, class, and fellows, we were going to take a break at this time, but considering we've only been meeting for 30 minutes and Patty Wentz is here and ready, are we ready to skip break for now and move on to Patty?
I think so.
Okay,
I think
perfect.
So unless the group objects.
Any objections to skipping our break?
We will still take a break, but just a little bit later, or depending on how quickly we get through things.
Perfect. Well, then I do want to take a moment here to introduce our special guest speaker today, also based on wonderful feedback from the committee and their request to have Patty come on board. But we have Patty Wentz with us, who is a communications specialist. And I'm just going to share a little bit of a bio, and then I'm going to turn it over to Patty, and she'll take it from there. But Patty Wentz has nearly 2 decades of experience as a strategic communications and campaign leader. She has worked on legislative proposals and public policies to advance justice, increase opportunities, and reduce barriers so people can care for themselves and their families. Her healthcare work includes agency experience, leading communication efforts to advance policy objectives, as well as consulting on public policy, political, and legislative campaigns. She has served as the communications director for the Oregon Health Authority, where she led the communications for Oregon's 2012 health system transformation that secured $1.9 billion in federal funding for Oregon and created a new model of coordinated care for Medicaid and the 2013 Medicaid expansion. After leaving state service, she consulted with the National Governors Association's Committee on Healthcare, the Washington State Healthcare Authority, and the Center for Outcomes Research Education at Providence Health Systems. In 2018, she coordinated the effort to pass House Bill 4005 for prescription drug transparency at the Oregon State Legislature. In 2020, working with Dr. Drew Weston, she created a United for Health messaging guide on health reform for Families USA. So we are incredibly grateful to have this breadth and wealth of knowledge. So without further ado, I will turn it over to Patty Wentz.
Oh, I'm glad that bio stopped. It felt like it was going on too long. Thank you for sharing that. And Katie, you had asked me if I had any slides, and I said no. But after hearing Michelle talk about what we wanted to talk about, I do think I sent you an email with a Google presentation. Would you be able to pull that up?
Yes, give me just a moment and I'll do that right now.
Okay. Great. I'm really happy to be with you all, and I'm super excited about the work that you are doing. It's coming at such an intense time on healthcare. I mean, who knows what the future is going to hold, but no matter what the future holds, the way we talk about healthcare is really important. I mean, what you are embarking on, I feel, is one of the most complicated communications challenges there is, because you're talking about healthcare and government, two really complicated, dense systems that people don't understand well, but have a huge impact on the lives of themselves and their family. And when you get that pulled up, Katie, you can maybe start on slide 4. We'll just skip ahead a little bit, because I'm afraid I have a hard stop at 2. I have to lead another meeting.
I'm glad it worked out that we got you in sooner then.
Oh, no worries. Yeah, that worked out really well. Can you do slideshow in the view? Yay, it's working. Okay, so Katie mentioned that I worked on a messaging guide with Families USA. If you're not familiar with them, they're a national advocacy group for healthcare reform. So Dr. Weston did dial tests, national online dial tests with nearly 1,700 registered voters to get their sense of get a sense of the best way to talk about health reform. So this is not specific to what you are doing, but I think it's really insightful to help us think about values-based messaging. Next slide, please. So this was 2020, but I think this is still true. I will tell you, I'm doing a project with Robert Wood Johnson right now, and I think this is still true. Americans have united beliefs on health reform. They believe that every child, every family, every individual should have access to quality, affordable healthcare and shouldn't face financial ruin if they need care. Too many people have been shut out due to cost, coverage, or color, and leaders must come together and finally fix the problem for us once and for all. Next slide, please. So one of the things that we found in the dial test, and I don't know if you're familiar with dial tests, they're much more complex than just calling somebody up and saying, hey, what do you think? Dr. Weston and his team read messages to people and could watch and gave them a dial and had them turn the dial when words or phrases resonated with them. So he found that sequences of words trigger different responses. So what you say matters, the order in which you say it matters, but one thing really stood out is the values messages explaining what the outcomes of the program or the policies would be and why they matter to people were much more persuasive and resonant with folks than the actual policy change. And that is something we definitely learned during health system transformation. We talked a lot about how things would be different for people instead of talking about the process, the policy change. Next slide, please. So here's what people want, and here's what they're afraid of when you ask them about policy changes for healthcare. And there are a lot of things to be afraid of in policy changes for healthcare because a lot of things have gotten worse for us over time. And people don't always remember the things that have gotten better. So they have a desire for choice, high quality care, affordable care, comprehensive care, healthcare for everyone. They are really afraid of losing what they have. Even though for many people, what they have is not good, at least it's something. So they're afraid of losing that. Their insecurity around healthcare. They're worried about high deductibles, premiums, and copays. Of course, high prescription drug costs. They really don't like socialized medicine because they have been told that they really need to be afraid of that. And they're also really frustrated that we're still in the same situation that we've been in for so long in terms of our broken healthcare system. Next slide, please. So this is kind of a repeat. The strongest messages activate the right neural networks, speak to values and emotions, and tell coherent, memorable stories. You'll hear me say this over and over again. Facts do not move people's beliefs. Stories move their beliefs, values move their beliefs. If facts moved people's beliefs, we would be in a much different country than we are in currently. Next slide, please. I think you can skip this one, I think, because I want to be very cognizant of time. Actually, you know what? I'm sorry, go back. Please forgive me. Sorry about that. So as I mentioned, successful storytelling connects with values and uses metaphors such as we all deserve the same quality of care or a family doctor. Like that is an outcome that people would like to see, that everybody has the same quality of care, or that when you want to see your family doctor, you can. Successful storytelling also raises concerns about what is getting in the way of us getting what we want, such as racial and economic inequality, insurance and drug companies, or politicians failing to lead. And also, successful storytelling restores hope. You want to always end in your messaging with how things could be better. Now, next slide. We found some sound bites that worked really well in the dial testing, where our health should not depend on our wealth. It rhymes, it's short. We should have the freedom to choose what's best for our family's health. Whether we're white, black, or brown, everyone who lives in America deserves the same health care politicians get. Again, this is not your policy, but these are the kinds of messages that popped when families talked about the health care policies that they were trying to advance. Next slide, please. And the Families USA guide that I emailed to Katie last night, she can share that with you all. There's a big guide that has all of this in here, so you don't need to remember it. But here's just some examples about the kinds of messages that worked. All of us should have the opportunity to live a healthy life and receive high quality health care, regardless of our race, ethnicity, or gender. If you were maybe an elected representative talking, or if you're talking to a room, I believe in a family doctor for every family. No one in this country should ever have to worry that they can't afford health care or have to choose between filling a prescription and paying for their rent or mortgage. Next slide, please. I've also been spending some time with this message guide, another message guide from Robert Wood Johnson, where they are doing some work to look at how to talk about systemic racism in our healthcare system. And they did a bunch of research a couple of years ago, and what they landed on is messages, the metaphor of building a bridge. Our current system has a lot of barriers to people because of their race. We need a bridge that is built for health and well-being. So having a good metaphor can be really helpful in talking about where you want to go. And here's just an example of the message structure that they use for this. Starting with shared values-based ideal. We all want to live in the United States where everyone has a fair and just opportunity to reach their best health and well-being, no matter their race, ethnicity, or class. And then you talk about the positive vision, sorry, and the problem. This can happen by making sure everyone gets quality care from doctors who respect them. I actually absolutely love that line, doctors who respect them. It can happen when families live in communities with well-funded schools and parks instead of polluted air and toxic waste dumps, and in neighborhoods with access to safe and affordable homes. We can build a society where people can move up economically and socially. This is not everyone's reality today. That's because there are barriers built in front of them in front of some of us that create unequal opportunity and threaten freedom and prosperity. By joining together, this is call to action. By joining together, we can unite to create a better future for everyone's children and grandchildren. And I think that's it with the presentation, so we can move into discussion. So again, yeah, values-based messaging. You all know better than anybody that when you use the phrase universal healthcare, that triggers stuff in people, or they don't understand it. So as you're building your messages, it feels like it might be helpful to be thinking about what will be different for people if this policy were to move forth.
Do people have, sorry. I was just
Oh, I was going to say the same thing. What
comments?
questions do you have for me? I know that
Yeah.
was really fast because I have that hard stop, so I'm sorry about that.
It is time for questions or comments. Does anybody have? I see. Oh, Colin, you have your hand raised.
Yeah. Hi, Patty. Good to see you again.
Nice to see you.
Yeah. Thank you for, that's great even just to have this in our it'll be in the recording, right? So we can refer to your quick slideshow for future reference, and other people watching this can go back and look at it. So thank you. Looking at, there was one slide that had 3 kind of main points, which were connecting with values, raising concerns, and restoring hope. And then a few slides later, you had an emphasis kind of on on the positive message. And I guess to me, it seems like only having a positive message about like what we want and how we can get there is not speaking in that moment to some of the big concerns and some of like the anger. Like specifically, I'm angry about our system. And so I guess I'm curious if Weston or with Families USA tried to how much, yeah, was there a discussion about anger, or like diving in for 60 to 90 seconds about how frustrated we are personally with different things? Or I'm curious about your take on that.
That's a very good question. So in the message structure, you want to, let me clarify, this is the general public messaging. These are not necessarily the messages you're going to use when you're talking to people who have a financial stake in the current healthcare system, or the healthcare delivery system, because I know those are big audiences for you. And that's a whole different strategy, and the communications has to support the outreach that people are going to be doing to those entities. So I just want to make that one clarification or qualification. But the message structure is start with values and then talk about why we don't have it. And that's where the anger lives. Like, what are the barriers to us not having it? So if you're talking about prescription drug prices, we all should be able to afford the drugs that our doctors prescribe to us that keep us healthy. Unfortunately, today, the prescription drug companies prevent any sort of price controls leading people into bankruptcy or having to make hard choices between food and rent. If we do XYZ, we can change that.
Okay.
Does that answer your question, Colin?
You know, I think so. Like, and I appreciate you clarifying that it's depending on the audience, which is what the whole point or one of the points of this community engagement group is to like which message for which audience and for stakeholders talking about, I don't know. I think there's some value in expressing how dissatisfied we are. But yeah, thank you.
Craig?
Thank you. This is kind of a half comment, half question, but it just popped in my mind when you were speaking. I used to work at a medical courier service, and sometimes we'd have health insurance, sometimes we didn't. And the point is, so when the Affordable Care Act was being passed, I was obviously for it and trying to tell my coworkers the positive things. So my question is this, and I was shocked. My coworkers would complain about not having health insurance, and now a plan is being proposed to offer them health insurance, and they were against it. So it's not just a comment. Maybe you can help. I'm trying to predict the future, how I'm going to communicate to people better. It was trying to make their lives better, but they didn't see it. So I was shocked that they were unhappy in the current system, but claimed they were going to be unhappy in the possible future system. So can you kind of, I don't know, help me out?
Yeah, it is true that people often, because people don't make decisions based on fact, they make decisions based on emotion, often make decisions or support things that will harm them. My brother-in-law is a doctor in Texas, which was refusing Medicaid expansion. And I said, why? I mean, why isn't the Texas Medical Association beating down the door of the state legislature saying, you know, we need this expansion, we'll get paid? And he said, it's because their values are no government. Like that was their strong value. They just, no more government healthcare. They could not get past that. I think where you started in asking this question is actually a path to an answer, because the other thing that we know is that when people tell personal stories about how public policy affects them, it can help break down some barriers. And if people listen a little bit more than they talk. So, you know, if you're talking with your coworkers, I can't count on, my healthcare is intermittent. I can't count on it. I have this health situation where I really need stable healthcare. Have you ever been worried about that? Or have you ever been, or anyone in your family, have you ever been worried about that? And give people a chance to talk. And this is one-on-one communication. This is not, you know, talking points and all of that. It's more like deep canvassing. But when you allow people to talk about what their concerns are, you have a better opportunity to reflect with them and share with them how the solution that you believe will solve the problem you both have. But it's not with giving them data. It's not with giving them facts. It's not by saying what's wrong with you, which is what I want to do to a lot of people. Grace.
I wanted to say thank you for sharing. I feel it was extremely valuable, especially in the work that I do. I see often when people do talk about policy, there's a feeling of a disconnect to the subject, and they really just connect at the why. So I appreciated that. So I did have a question. So how do we ensure that our messaging is like both accessible to those really unfamiliar with the system and also compelling enough to engage people who always have the why or the necessity of the change? How do we balance those two audiences? Because, for example, me, if I see something that's just a broad, hopeful messaging, I'm like, okay, well, what's the mechanics? Then I will have to look. But sometimes there isn't always that call to action. This is letting the community members know. So I'd love to know how you balance that strategically.
I think you start with the storytelling and the shared values, and then here's how we'll do it by coming together to pass legislation that, and this is where my lack of policy knowledge on exactly what you're doing is going to trip me up, by passing less legislation that provides healthcare for everyone, doesn't increase, whatever messaging goes with that, that is how we will get there. But again, you guys, I do want to repeat, you have really, really different audiences. And for the stakeholder audience, based on my experience at the Oregon Health Authority, outreach really leads that work and communications supports it. Because if somebody's worried about losing money because of your new bill, there's no messaging that is going to help with that. It has to be, they have to be heard and be able to ask a lot of questions back and forth. It's not just a messaging situation. And also there's political power dynamics that play into this as well. Michelle. Hi, Michelle.
Hi, thank you so much for this. This is so helpful. I wish you could be in all of our meetings, selfishly. Two questions. One, I'm a trained community organizer. I've spent a lot of time on the doors, and I know from experience how important it is to be able to talk in concrete terms, using examples, using stories. But often the non-polarizing messages that are just about the community need take a lot more words. They take a lot more time. They have to happen within the context of an interaction.
Yeah.
We also have to call this something.
Mm-hmm.
We also have to say who we are. Like, we are the Universal Health Plan Governance Board, for better or worse. That's what we are, branch of the, or part of the executive branch of the state government. So I'm curious, when we do have to describe this plan, and jargon gets so loaded, right? It ends up with so many connotations that have nothing to do with what it actually does.
Yeah.
What are your recommendations for kind of depolarizing to the degree that we can when describing our work at the most basic level, like on our website or in a one-pager, or when we invite someone to a focus group and have to tell them what it's about?
That's a really good question. I mean, I think the intent and the value behind the phrase universal healthcare is the right one. It's just been twisted. So I wonder what it would feel like if it was something, we believe everybody deserves access to quality, affordable healthcare. And this is our path to get there. I can't come up with a name on the top of my head, though.
Yeah, fair enough.
But but I should say there is risk in being too cute by half. So you want to be careful of that.
Right.
When you're naming it.
I mean, I think we want to use terms that do the least harm as possible, knowing that there's been a coordinated, well-funded attempt to muddy the waters for any term that could refer to what we're doing. But I also hear you emphasizing that we need to be as descriptive and clear as possible in a values-focused message, in addition to the jargon that we have to use.
It's really hard. And Colin, I do see that you have your hand up. I'm sorry. I just want to say one other thing. I mean, the average American reading level is sixth grade now. It's gone down. So, plain language as much as possible is going to be really important for your public facing communications, and you will have something to describe to them by that point, right? You're not going to start your public conversations until you have the draft of a plan. Oh, but here is something that the communications committee you can't have the drafters of the plan not be thinking about communications. Like, that plan is your first communication. So that plan you want the plan to reflect your values-based messaging and be as plain language as possible. Sorry, Colin.
No worries. just a comment, I guess, on like how even that how every language seems loaded. When hearing you say we want to make sure everyone has access to care, I hear people, the word access gets my radar pinging, because I think a lot of people would say, well, everyone already does have access to care right now, which is not true.
I don't think people believe that.
Well, I have had conversations where people are arguing against that point, arguing for that, using
Yeah.
that, latching onto that word in the way that I'm doing right now. So anyway, we have a big challenge. So
yeah, that makes sense.
In
Anything
Eugene,
else?
people would
Oh.
definitely not say we had, I was just gonna say, in Eugene, people would definitely not say we had access after United Healthcare bought one of our large practices and we lost many
Oh,
providers.
yeah.
Um,
Right.
And they closed a hospital. But I do hear that, yeah, that word means different things to different people, I think, maybe is Colin's point. Scott and then Michelle.
I don't think Scott is a board member.
Correct. Yep. Scott, thank you so much for your interest in sharing comments. But this moment in time is just for committee members. But please feel free to sign up for public comment in the future.
So one other question related to what you were saying about some of these targeted this targeted outreach that the legislature has really tasked us with, that have a financial stake in the current system.
Mhm.
One of the, I think we're unique from some of the work that you've described, in that we aren't selling a plan. We're not saying, here's our plan, here's why you should support it. We're saying,
Okay.
here is a draft. We want your input on how you think this might work, how you think this might not work, what unintended consequences you see, what you think is missing, and then really listening deeply to bring that back and inform a revision of the plans.
That's really helpful clarification. Yeah. And that will be so helpful to what you're doing.
Yeah. So I think I guess this might be too big of a question, but does that spark any thoughts, any general guidance in your mind, in terms of like, we want to frame those questions really carefully. We want to frame that approach really carefully.
Yeah.
Yeah. Do you have any response to that?
Well, I think the questions and the mechanism you'll want work best when it's meaningful feedback, and the questions have some specificity to them, not just what do you think, it's like, we are doing this, what do you think of what part of this do you not like? Like and not like is not the right phrase, but yeah, drill down on some of the specifics of the plan to get feedback.
Max?
Yeah, thanks, Patty, so much for this presentation. One other idea, and I think this is just a follow-up from what Michelle just suggested. Would you think that one of the key things in terms of hearing people's narratives and their concerns would be maybe to focus and process, especially that fear of loss that could be perceived? So like, again, kind of a deep dive into their emotional response, but isn't like a fear of loss one of the most powerful things? And when we're listening to that, kind of figuring out then how do we sort of address that and sort of build that into a communications plan going forward? Is that kind of like a really key area for us to focus on?
Yeah, recognizing it is definitely important. And I'm taking Michelle's point that this is not about selling something. It's that you're getting feedback on something. But I think there is universal belief and recognition that our current system does not work, except for a few people. It does not work for the vast majority of us. So I wouldn't start with fear. One important thing in communications is to not repeat your opponent's messages, because that just puts their messages in your head. So I think recognize the fear, but not Like, we're all afraid of change, like stuff like that isn't as helpful as we want it to be. It doesn't inoculate in the way you think it's going to, or the way I used to think it was going to. I'm afraid I have to jump. I have to lead this 2 o'clock meeting, but I really enjoyed spending time with you today.
Thank you so much, Patty.
Absolutely. If you have any follow-up questions, feel free to reach out.
Yeah, I'm sure we will. And I'm sure Michelle and I would love to maybe get some time with you to do some strategizing.
Oh, I'd be happy to help.
Thank you.
Thanks
Thank
so
you.
much. Enjoy the rest of your day.
Thanks.
Bye.
So we're now at an hour. Are people feeling like we should take our short break now, or do we want to kind of plow through, because I think the next few items aren't very lengthy? So how are people feeling? Would you rather get done sooner or take a break now? How about raise your hand if you need a break? Otherwise, we'll keep going. Okay. We need a break. Okay, so Katie, 10 minutes, and so the new time would be 2 to 2:10. Okay, so back on at 2:10. See you all then.
It's now 2:10, so if committee members can go ahead and get situated, and we'll get started in just a moment. Co-chairs Glass and Fellows, I think we can go ahead and get started when you're ready.
Great. Welcome back, everybody. Our next agenda item is hearing from you all any committee member updates of engagement opportunities that you've done or that are coming up, or anything else that you want to share with the group. I know we have, is that you, Jensina? Jensina?
Hi there. So coming up on this Saturday, actually in Eugene, we have the second citywide healthcare forum coming up. Amy, co-chair Fellows, has actually agreed to be on our panel along with Senator James Manning, Representative Lisa Fragola. We have a battalion chief from the Eugene Springfield Fire and EMS department. We have a representative, actually the president of Healthcare for All Oregon, a hospital staff nurse. And before the forum, the NAACP here in Eugene and Springfield is putting on a 3-hour health fair. So we've got about 20 vendors actually that are going to be tabling and providing information to forum attendees. And then there will be a 2-hour forum. It's a question and answer agenda for the community to come together. Last time we did this forum, we had about 200 people in person, another 200 online. We're shooting for 500 for this Saturday. And I will be the forum moderator. I'm the committee, I'm one of the committee co-chairs. And tonight we're having our final prep meeting. We're going to be doing orientation for our ushers. We're very excited about it. So on Saturday, by Saturday evening, I'll be done letting my hair down, having a glass of wine or possibly 4.
Thanks, Jensina. And one more person that I didn't hear, is Eve Gray still on the panel? Because she's both the Lane County Health and Human Services Director, and she's also on our plan design. Is that right, Katie?
Yes.
Plan design committee. So
thank you for reminding me.
So there's 3 of us, 4 of us with connections to this work on the panel. Great. Michelle.
I'm going to be connecting with the Southern Oregon chapter of Healthcare for All Oregon on Sunday at the regular monthly meeting, just to touch base, give an update, and answer any questions. So I will report back.
Any other things coming up people want to share? Colin, I see you.
Yeah. Nothing really specific right now, but just, I guess, a further update from Healthcare for All Oregon. We've had a lot of increased engagement with our volunteers in the last 2 or 3 months. It's been really a substantial increase from a slow trickle to a smaller, less slow trickle. So so that feels good. And we're starting to advertise more events like the one in Eugene. I'm so Jensina, hearing that it's almost sold out or almost at capacity or at least 500, however many people you get, sounds really good. So that's great. So no specific update, but good movement happening at HCAO.
And I just remembered another event that's actually happening tonight. So maybe I can send Katie the information if people are wanting to do a Zoom tonight, or if you live in Corvallis. The Mid-Valley Healthcare Advocates are having a kind of town hall thing, and Bruce Goldberg from the Universal Health Plan Board, Mary Lou Henrich, who is the newest member coming onto the Universal Health Plan Board at our next meeting. She was just recently confirmed. And John Santa, who's a former Oregon Health Policy Board member, and which is he on plan design or finance? I can't remember. Operations?
Finance and revenue.
Oh, finance and revenue. Yeah, I think those are the three people, and then there's a facilitator who I'm not familiar with, but that is happening tonight at,
I can tell you. I have it
thank
up.
you.
Yeah, it's tonight, February 26th, 7 to 8:30 at the Corvallis Benton Public Library, 645 Northwest Monroe Avenue in Corvallis, and online.
Yeah, and there's a Zoom option. So if people are interested, I can make sure Katie has the information to send out maybe right after this meeting. So you could attend the Zoom if you would like. And I'm sure that we could also ask for the recording. Since they're Zooming, I'm guessing it's going to be recorded. So that's something maybe we can share also. Any other updates people have? Okay, I think our next item is just kind of reflecting on today's meeting. It'd be great to hear your reflections about our guest Patty Wentz, and just starting to get us thinking around the strategic communication, how people are feeling about that. And then if there's any future topics that you would like to hear more about, now's the time to share that too. Grace?
I just had one small suggestion. Since Patty suggested that, our outreach will really be targeted based on our audience, it might be nice to structure future conversations based on the audience that we're talking to so that we can kind of have it a little bit honed in. At least it would be helpful from my perspective. And I see your dog, Michelle, I think. So sweet. But yeah, I think oh, your cat. Okay, my bad. Um, but yeah, I think just having targeted structured conversations for the different groups we'll be talking to would really be helpful, since I'm sure we're all knowledgeable. Just honing it in on what we're talking about and rallying behind that one subject matter per meeting would be nice.
Craig?
I just like to compliment Patty. I thought she was good, very knowledgeable. I like to learn. I like to listen to others who know a heck of a lot more than me. And I still like her to talk to us more because she's got so much experience. And that's it. I just wanted to share that. Thank you.
Yes, we are hoping also to work more with her, I think. Any other reflections on today or ideas for our future meetings before we move to public comment? Do we have one? Is that right, Katie? Okay, seeing none, I guess we'll move to public comment. But if you think of something later, email the email that you all send information to, and we will take that into account as we plan for our next meeting in March. Okay, Katie.
Yes, thank you, Co-Chair Fellows. We have Bobby Hall signed up to share public comment today. Bobby, are you available to connect your audio and camera?
I clicked the boxes.
There you are.
So
Yep,
can you hear me?
we can see you and hear you. So you got
Oh.
2 minutes to share your public comments.
Okay. Well, what I was talking about was what you all were talking about a few minutes ago. I was thinking about the concern about how we present ourselves to audiences. And at one of our meetings, someone reported at our Corvallis area, this is the legislative committee, so-called, of Mid-Valley Healthcare Advocates. I learned how Pennsylvania resolved to discuss what they are talking about, and they're talking about the same thing we are. They found a name that works for them, and it is Family and Business Health Security Act. Now that sounds very different from what we are talking about when we're talking about giving healthcare for everyone, right? That's what we like. we like health care for everyone who lives in the state. But when you think about it, they all said that they liked it. They didn't like the name single payer because they felt it distracted people from what was really going on. But they liked this name, Family and Business Health Security Act. So the security part was very important to them. And that gets away from any kind of a jargon. It's not anybody's jargon, I don't think. And I think we should think about things like that for people who are kind of business oriented, because they know they will be paying for it through their taxes in some way or another. But they know that they will be getting what they want. So I thought that would be interesting for us to think about. And as I say, one of our members attended this nationwide group. It's a kind of called the single payer group, I think. And of course, that's an insider's term of all of us who know what we're talking about. And so it doesn't bother us. I mean, I lived in Canada for 4 years and I loved it. I loved it. That was in 1970 to 74. It worked fine for me. So I don't have any fears, but people who have not experienced it do have fears. And I think that was made clear. So thank you.
Thank you so much for those comments, Bobby. It's very much appreciated. And with that, I will just turn it over to the co-chairs to conclude the meeting.
Great. Thanks everyone for our meeting today. And like I said, if you think of things between meetings, go ahead and email. And we will see you next month. I don't have the date in mind, but in March, the end of March. Katie, I don't know if you have it in front of you.
I think it's the same exact day, actually.
The 26th. Oh, that's right, because we're on February, 28 days. Yep, so we'll see you March 26th, 1 p.m. Thanks, everyone.
Thank you.
Thank you.
Thank you. Thank you.